Well, hello everyone and welcome. My name is Christina Anastasio. I'm the Associate State Director of Community Outreach for AARP New Jersey. We are so excited to be part of bringing this important webinar to the community, and just so many thank yous to Robert Wood Johnson University Hospital Somerset for their outreach and education around this important topic. This is the first in our week-long series of events, so if you haven't already, check out some of the other ones we have coming up as well. But we're just very excited to be able to bring this education and information around telehealth and COVID precautions to the community. AARP believes that telehealth is a promising tool to help people access healthcare in new ways and make it easier for family caregivers to care for their loved ones. Our engagement on this issue is to advance the needs and preferences of consumers, especially family caregivers, with telehealth. More and more of our members, largely those aged 50 to 59, are using mobile devices and tablets to access information about their health. AARP believes that telehealth holds the promise of multiple solutions to help people access health and home and community-based services in new ways and make it easier for family caregivers to care for their loved ones. We want to play a role and help make the voices of our 38 million members, the community at large, and the nation's 40 million family caregivers heard on this issue. We see our engagement on this issue as a way to encourage lawmakers and the industry to consider the needs and preferences of consumers when they address telehealth. Prior to COVID-19 public health emergency, New Jersey had started to move forward in allowing the use of telehealth, but it was happening kind of slowly. While some providers were practicing telehealth already, in 2017, New Jersey passed a law that helped more providers to engage in telehealth. The law gave a new definition of telehealth, so we are all working in the same terms and gave partial coverage parity and addressed things like licensure, reimbursement, all those sorts of things. And in 2009, Governor Murphy enacted a law entering New Jersey into the multi-state nurse licensure compact, which helps allow nurses who don't reside in New Jersey to provide care to New Jerseyans, thus broadening access to providers for New Jersey patients. So obviously when the pandemic happened, everything started going rapidly. Many states, including New Jersey, have moved quickly to try to provide increased access to telehealth. Governor Murphy has enacted Law A3860, allowing out-of-state providers to provide telehealth in New Jersey for coronavirus issues only. The enacted law, and there was also an enacted law, A3843, which requires Medicaid and private health insurers to provide coverage for telemedicine services during the state of emergency. For Medicaid and private health insurance plans in the state, excluding those governed by ERISA, the law provides telehealth coverage parity and eliminates cost sharing for telehealth services. So during the pandemic also, New Jersey Family Care, New Jersey's publicly funded health insurance program, has issued guidance that legislation and federal waivers removed requirements around provider-patient location, technological devices, HIPAA, establishing the provider-patient relationship. It waives face-to-face requirement at federally qualified health centers. It expedited licensure for out-of-state providers, and it allowed providers to bill using in-person codes and rates. And then Medicare has also provided guidance that structured day programs that can provide services via telehealth, such as care management, illness management, and recovery and coping services, and medication counseling. So that's just in New Jersey. Nationally, Congress and the administration have been quick to act. Through the first coronavirus package and subsequent orders through Centers for Medicare and Medicaid Services, they have lifted the geographic restrictions for Medicare, allowing someone to utilize telehealth at home no matter where they live. Under Medicare, they broadened the list of services available for reimbursement and sweetened the reimbursement for providers. And Medicare will cover telehealth checkups and follow-up visits are covered. So for anyone wanting to dig a little deeper into the changes made for legislation around this, I would encourage you to check out the COVID-19 resources page on the Center for Connected Health Policies website. And I can put that website in the chat, but we're just so happy to be able to work on this from an advocacy perspective. And we know Robert Wood Johnson University Hospital Somerset is really on the ground and doing great work as well. So I'll pass it over to you, Serena. Thank you so much for partnering with us on this event. We really appreciate it.
Oh, thanks, Christina. And good afternoon, ladies and gentlemen. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. And it is a pleasure to welcome you to our webinar on telemedicine and COVID-19, presented in collaboration with AARP. So during today's webinar, we will be discussing the importance of taking care of yourself during this time, appropriate precautions that healthcare providers are taking to ensure your safety, what measures you can take to secure your health and safety as you are continuing to work, considerations to keep your family safe, conditions that warrant maybe some emergent care and prevention strategies, as well as options with telemedicine or telehealth and how you can access them. So our guests today are Harshal Shah, a digital patient experience manager at RWJBarnabas Health, where he leads the strategy, development, and implementation of all the system-wide telehealth initiatives and oversees digital provider experience and patient experience for the upcoming EPIC implementation, and Dr. Thangamani Seenivasan, who is a board-certified surgeon on staff at Robert Wood Johnson University Hospital, Somerset. So thank you, gentlemen, for joining us. We greatly appreciate that. And let's see, I just want to switch over to make sure that the audience can see you both. So let me just see. For some reason, I'm not getting Dr. Sinavasan. Let me just, everyone, here we go. There's Dr. Sinavasan. So thank you both for joining us. We're going to begin our webinar with about 40 minutes of a moderated discussion, and then we will open it up to questions and answers from our audience. If you do have a question for either one of our presenters, please log that into our chat feature, and we will get your questions answered at the end of the webinar. So why don't we begin with having each of you tell our audience a little bit about yourself. I mean, I just very briefly gave an overview of you both. So Harshal, if you could, for our audience, explain what your background is and, again, your role as a digital patient experience manager. We'll start with you and then we'll move on to Dr. Seenivasan.
Great, thank you, Serena, and really happy to be here. I hope the information we present is helpful. So a little bit about myself. My background is really stuck with administration and healthcare across the board. IT is just a big chunk of my experience in the background. So in my previous employment history, I guess, I've gone through multiple patient portals. I've gone through HIE. I've also now officially have gone through telehealth fully, and it has kind of impacted in one or the other. It's really a high-level administration function. It's really operational function. But if you kind of focus down in the dirt of it, it's really a provider-centric and a patient-centric function. And what that means for everyone else. We want to make sure that we're providing the adequate, the best fit care in the process operationally for our patients as well as our providers. So that really becomes important, anything we do. And that's really what experience talks to. We talk about experience all the time here and there, but it's really focusing on the patient and making sure the patient is able to adequately communicate with the provider or the clinician at one end. The other stuff is really something else that we have to build upon, but that is really all determined by patient-centric situation. So my kind of background comes from the perspective of both patient experience. In my history, in my school, I really focused on bridging the gap between a patient and a provider and what that best looks like, and also bridging the gap between IT as well as clinical. So I think that's where my experience really stands out. In my multiple other areas of focus, I touch on pretty much every perspective of a healthcare operations system. We go through policy, we go through patient portals, we go through HIE, as I mentioned. It's really what's going to be important for the patient.
Great. Well, thank you so much for that explanation. Appreciate it. Now, shifting over to Dr. Sinavasan. So Dr. Sinavasan, on staff, you are a surgeon, but we know you play many roles here at RWJ Somerset. So can you maybe share with the audience, what you do and what your role has been during this pandemic?
Thanks for having me, and thank you, Christina and Serena, for hosting this. And Harshal, thank you, and I am glad for all the guests. I'm able to help here. I would say I'm a surgeon, so when it comes to healthcare, we deal with two situations: emergency and elective or office visits. So we have gone through hard times since March, and we have basically, as a community of doctors, basically not only surgeons, all the doctors in the hospital have created, by extensive discussions following national health guidelines, every resource available, we have created a safe environment for our patients like we had before. So our goal is to provide the safety and uninterrupted health care. So that is our goal, and we have been doing this successfully. And the credit belongs to many resources and people and personnel in the hospital. And we have gone through research, we have gone through experiences, and I am very satisfied with what we can provide as a hospital, as a community, to our patients, so that there's no compromise in their care.
So thank you for leading into that, Dr. Sinavasan. So as you know, our numbers in New Jersey and within the county our COVID numbers are starting to climb. And so is the hospital continuing as, normal operations? Are all services, operational, now, and, have any ceased?
You're correct, Serena. The first part you asked, is there cases continue to climb? Unfortunately, yes. And most of them are from the community. They are not from the clusters that started from the hospital. I'm glad to say that. The second part is we continue to provide our services uninterrupted, and we are hoping with the current system to continue, and we haven't stopped any services. So for people out there, if you are concerned about your care, please don't compromise waiting. You are safe in the hospital. The protocols and the policies from the door to the operating room, or from the door to wherever the labs or CAT scan is organized well, and we are doing the best. And you are safer, and I wouldn't put off my treatment or defer the care coming to hospital.
Right. So presently, then, I think what you're saying is that the hospital's is operating at normal operations presently, correct?
That is correct. We are doing all the operations normally.
And with the pandemic climbing, do you anticipate any services kind of stopping or ceasing? Because I know in the beginning of this pandemic, correct, there were some, elective surgeries and things like that that had to cease because of the widespread pandemic. And maybe this is something you might not even be able to answer or predict right now. But what are your thoughts, Dr. Sinavasan?
My thoughts are, our experience in March to May was very hard. Many of the patients needed ventilators. So we had to shut down the elective surgeries. Now, we have a treatment that are available, and although the number of cases have increased, the number of patients who needs ICU and ventilatory care has not increased. So which we are fortunate about. So at this moment, we can't predict how a pandemic will pan out, but we are confident our treatment is effective and our patients are returning home. Our morbidity mortality has increased, And I am confident based on our current available treatment, our resources, we won't be shutting down, but we certainly have to follow our principles. I mean, I would like the community help in a major factor in this. We always have social gatherings. We are social animals. So there are things we should continue to follow to this stop the escalation. Like this weekend, it's a major Hindu festival. It's a Christmas version of Hindu festival, Diwali. So I am sure everybody wants to gather with their families, friends. I certainly would take caution, and this may be a time that you have to restrict your gatherings, restrict to your family only. There are many things you can do to help us, and I can go about this on and on, but there are things out already. You know the 4 W's, and everybody should be following this compulsively. Wear your mask, wash your hands, and watch your distance, 6 feet, as well as when concerned, when you're worried about something not feeling right, get medical help. Do not keep attending social functions. Hey, it's one of my common cold. So there are many you can do to prevent this becoming a major problem. Like my views, it's my personal views, like Serena asked me, I'm confident we'll continue our services.
So thank you for mentioning what they can do to stay healthy. And as you mentioned, there's the 4 W's. You want to wear your masks, you want to socially distance, you want to wash your hands regularly, and you want to stay home when you're sick. Now, you also mentioned, Dr. Sinavasan, that we've done a lot in the hospital to keep everybody safe, and you're very comfortable and confident that we will continue to do so, as we all are. So if you wouldn't mind, share with the audience what safety precautions has the hospital taken to ensure everybody's safety?
It starts at the doorsteps as you enter the hospital. We have protocols, policies, and we restrict visitors. Doesn't make entirely happy. Our visiting hours are restricted, and number of visitors per family are restricted, and it helps everyone. And at the door, you are being screened. The very standard questions that related to the COVID are asked, and we like the honor system, and the people answer the questions, and everybody got a temperature checked. So that's a doorstep. And once you step into the hospital, whether this is an elevator or whether there is a meeting area for the nurses and doctors, you will see everyone wearing a mask, and you will see everybody washing hands before and after touching anything, everything that they come across. And you will not see people sitting close to each other, and they are watching the distance. And our nurses are on the bedside, and they take enormous care of your people you love, and they constantly on the correct pathway. And I think it starts from door, and there isn't anybody exempted from this, whether you're a patient or a visitor. And we encourage all of our patients to wear a mask unless they are eating or drinking. And we do not allow communal gathering within the hospital, like nurses sitting together eat. They all have a separate time. In the operating room, we have personal protective devices for the doctors, nurses, and people who work along with us. And the hospital has taken enormous pride in obsessively cleaning every part of the hospital and disinfecting the hospital more than necessary, if I would say. I mean, we take already enough precaution in a standard day. We are being extra cautious. This goes on and on. And we do believe that if we continue to what we do, the most important thing is consistency, and everyone to be consistent. I think that's what we are trying to do. I can ask, Serena has seen what's happening in the hospital, and all of you whoever been visiting a family, you could add what you see, or you can ask me what you see you don't like. And I also have Shisha Patel with me. Come on, Shisha, show your face. Shisha is a patient advocate representative, and she speaks Indian languages. So she is one of them with all the information. She walks around the hospital. Her health hasn't been interrupted. She takes precautions like everybody else. So we do have whatever we have to do every day, and I think every second, I would say. Thank you.
Okay, thank you so much, Dr. Sinavasan. And it's probably important to note too that the hospital is also doing COVID testing and making sure that we're keeping people safe in specific areas of the hospital as well.
Correct. I think, Serena, that's the most important part I probably have missed out. We do not allow any procedures or operations, whether they're minor or major. All of them get a COVID testing done before the surgery, either through the emergency room surgery patients or the elective surgery. And from the day of the test, patients are advised to restrict and quarantine so that after the test, they don't expose themselves to anybody prone for COVID or exposed to COVID. And that is one of the part of the policy and protocol. And it's working very well.
For many locations.
I just wanted to mute one of our guests. Go ahead, Dr. Sinavasan.
I think that's one of the key protocol, COVID testing. And we have unrestricted amount of COVID testing available. There's no delay in the COVID testing, and we are proud to announce that too.
Okay, great. So, I know I hear from so many people that are so afraid to come to the hospital. I mean, I know you've just shared so many different safety precautions we are taking here at the hospital to keep everybody safe. But some are still afraid to come to the emergency room and delay seeking care. And so in many cases, it's critical that they come to the emergency room. So what are some types of symptoms that, do need immediate care? And what are the risks of delaying, seeking the care?
Well, it is unfortunate, and we all have a fear, and it has to be reasonable. We all have concerns, and hospital is not always a fun place. But I think the most important thing is, if you need a health care with the pain and something persists for you, and your primary care doctor is not able to help you as an outpatient, and he suggests you need to go to hospital, please listen to them. And also, there are times, when emergencies, cuts, abdominal pain, I can go on this forever, headache that doesn't go away, or a mass or a lump you feel that's bleeding, anything from cancer, heart problems. If you think it's going to go away, it's not going to go away. If your primary care doctor says it's not something you can be done, it's the same thing what you did before COVID time. I wouldn't change anything. Just go, and you are safe in the hospital. Of course, you have to be cautious. You have to be careful. You wear your mask and limit the number of people who travel with you, and you will do many smart things that are recommended. I don't think there is any need for you to hold your treatment that's needed today to another day at this moment.
Okay. So, and one of the last questions that I have is, with the holidays coming up, you talked about, the four ways that people can keep themselves safe. The masking, the hand washing, the social distancing, and staying home when they're sick. But with the holidays coming up, can you share maybe some good practices or ways that they should keep in mind to protect themselves, and how they can potentially social distance with all the different holidays that are upon us?
I think most of them not going to like me from what I say. So unless, like, there's a Diwali festival, then followed by Thanksgiving, followed by our December holidays coming. So we see increase in cases. Obvious reason is gathering, communal gathering. So it is obvious we are gathering in big groups. That is not helping us. So holiday time is exciting. Certainly is a time for the family and friends, but there are times we have to make exceptions. I mean, I would recommend, if this is me, like if there's a family celebrating a festival, it should stick to the family living in the household. I mean, you definitely don't want to expose your parents or grandparents, and also invite friends, which we love to do. I think we are not anywhere close to that situation, yes, especially with the increase in cases. So celebrate within your family. And then if you do have your parents, you certainly should wear a mask. There's no shame in wearing a mask. You don't want your parents to get the infection, and you don't want them to get sick. So I would, even in a gathering at home, don't sit too close to each other. Don't share meals and communal sharing. Wash your hands and try to make separate dishes, and try to wear a mask. I mean, wear a mask. And when in doubt, you think one of in the family is not feeling well, whether it's common cold or you don't know what it is, first cancel the gathering. When in doubt, this is where we are continues to see the problem. I thought I was going to be okay, then you end up in 30 people related to that gathering. So I certainly would like the honor system. If you are in doubt, presume it as the worst scenario. And certainly you seek medical help, but in the meantime, I would cancel. I hope we will get the vaccines. We are all going to have a fantastic festivals in 2021. I think it's good for all of us not to do any gathering bigger than small numbers. I would say single digits.
Okay, thank you so much, Dr. Sinavasan. So, one of the other ways I know we've been trying to keep everybody healthy is through telemedicine. And, with our numbers climbing during this second wave, telemedicine is becoming more and more important. So, Harshal, can you maybe share with everybody, explain what is telemedicine or telehealth? I know we talk about they're two kind of different different options, but I'll let you explain.
Yeah, so really at a high level, they're the same. We're really moving away from using two different terminologies to describe that perspective. So if we, it's really just telehealth or telemedicine, whichever function is used. So for our conversations, I'll keep it at telemedicine. So telemedicine is really just the communication of audio, video between a patient and a provider, or a provider with a provider. Because often consults happen when a patient is with one provider and a consult to another specialty or something like that. So, at a high level, telemedicine is the communication, a modality, a new modality that's kind of sweeping the nation, but that is available to patients and providers to communicate when not in person.
Okay, so when is telemedicine an option for individuals? And is it an option for everybody?
So it depends. So there's a lot of factors that come into play when telemedicine becomes an option, right? So during this pandemic, for example, people were afraid to go into the facilities, clinics, because they're going to be susceptible to the pandemic. They wanted to avoid interaction, minimize the interaction, but they still needed care. So in that situation, it's really up to the patient and the provider's discretion if a telehealth visit is appropriate or not. In other perspectives, a lot of states, a lot of areas in the states, we have established protocols for telehealth. We have established protocols for doing a visit. And it's really, what we're seeing right now, what I'm seeing right now is it's becoming more of a normalcy to have it available. And it's going to be kind of taking over more and more prospects of care across many things. It's really, we're all driving, this health system is driving toward digital innovation and digital health.
Okay. So now, what specialties use it, and will it continue to be an option? Now that we have our pandemic.
Yeah, so I think it's, again, I'm gonna base it off of the health system discretion, if it's gonna be an option or not. If it's available, if it's doable, I think it will always be an option. But it's really if the patient is comfortable doing that, if the provider is comfortable seeing the patient in that way. There are some instances that the provider may require the patient to physically come in and take the necessary protocols of safety to see the patient for their care. Maybe it's too complicated to do over telehealth. It's also going to be coming down to the various other specialties. We have a second opinion, we have oncology, we have post-surgical care that can be done via telehealth. We have PCPs that are using it today. We have rehab that's using it today. These are all kind of coming from and derived from the states and federal regulations that are coming through because of the pandemic. But it's really showing us that telehealth is becoming more and more adaptable in various scenarios. Not all scenarios, of course, but in various scenarios.
Okay, thank you so much. So I want to dive into a little bit more about, who offers it. I know you were just discussing some specialties, but even let's look outside, of our own hospital. Is this something that, all providers are using? Maybe do we have other, sorry, I just wanted to fix that. Do we have other healthcare providers such as pharmacies? And, again, there's also stuff digitally, right? How can they access it? So could you maybe go into a little bit more on that?
Yeah, so today, as I kind of alluded to, so today we are at our health system, we're using it through our PCPs, our medical group. They're accountable. And what's really happening is that it's up to the provider and the patient conversation. So if a patient calls, like, I'm not comfortable coming in, would it be okay if we do a telehealth visit? Is that possible? I think if it's doable, I think it'll be possible. And then beyond going here, we have telehealth coming from second opinion oncology visits. We have oncologists using it across the system. We have, I'm not sure at our system where that extent is, but we have other specialties. I know rehab is using it at all of our hospital sites and all the functionalities. We have pharmacy is something that's a very star on my head, in my mind, but it's really, it's doable. It's not doable, it's doable. It's really reliant on if the provider is going to be able to provide the information that the patient believes is important via a telehealth simple solution, whether it's medication management and something like that. I think, there are other health systems that are doing it 100%. We also have the perspectives of provider-provider interactions now. I really like that conversation because there could be miles and miles of distance between two providers, and a provider has a patient with him, a PCP, and the PCP wants a specialty consult. Instead of the patient driving all the way over to the specialty, they may be able to just use a telehealth visit to see the provider while the patient is there. So that's also available. The other things that are coming along the pipeline is something called e-visits. E-visits is a one-way visit. So it's really meant for low acuity conditions that the patient will log into their patient portal. They would say, I have a cough, and they would be asked a bunch of symptomatic questions based on your symptoms. And then that information would get relayed to a provider, and then the provider would provide that feedback. So it's really, it really accommodates multiple areas of telehealth. When we really talk about telehealth, I kind of went into this. We have e-consults, we have video visits, we have e-ICUs, which is tele-ICU. We have tele-acute ICU, we have second opinion, we have remote patient monitoring. That perspective has been also growing multiple areas, because when a patient is at home and wanted to get monitored with blood pressure, weight scale, temperature, it's being possibly done by remote patient monitoring. Pulse ox meters being sent to them. We've accommodated all that to help our patients as much as we can. And then I also talked about, e-visits and video visits, where they're really coming and to fruition, and their process is really being cleared out. And I think, I love that. I love the terminology for digital health, but it's really moving toward a digital innovation structure and making sure that even if the patients are not within our walls, we can still provide care to them.
Okay, well, thank you. So, Harshal, now tell me, let's talk about what are the benefits of telehealth or telemedicine. For this purpose, you want to go with telemedicine.
Yeah. So, I'm going to talk about the patient a little bit first, and then we'll get into the provider benefits.
Okay.
Telemedicine really provides the ability, pandemic-related safety. Number one is safety. Really captures that safety perspective for our employees, our staff, our providers, as well as the patient and their family members. It really provides the benefit of safety. You're not at close range during this time, not with other patients. You're simply seeing a patient virtually or a provider virtually. And that's kind of going on to both perspectives. Travel time. Patients don't have to drive anywhere. It's really open the phone. I'm going to turn on an app, and we'll get into the app perspective a little bit more later, but I'm going to open the app, or I'm going to contact a provider and go to their link. I don't have to travel anywhere. I don't have to drive anywhere through traffic or whatever that could be. It reduces time off of work. If I had a meeting or appointment scheduled for 12 o'clock, I don't need to worry about it. It's going to take me 20 minutes to get to the provider's office, approximate visit maybe 20, 30 minutes, and then 25 minutes to get back. So I just lost a whole hour of lunch. I'm just giving an example. But it really provides that convenience perspective for a patient across the board. And then it gives you the alternate access if a provider is really far away from here. South Jersey, a provider South Jersey or North Jersey, and a patient is somewhere else in New Jersey. It provides that access and really grows that access for a patient as well as the provider. Our reach really expands with telehealth. And then you can also, some instances, you can add multiple people. So if there are family members that you'd like to take part of in your care, you can add a caregiver in a telehealth visit, to make sure that they're aware of the process. Maybe it's a proxy. Maybe it's someone at college and the parents want to join. So it's all those things beneficial around the patient. When you really get into the provider perspective, it's really time management. At this rate, we can see a patient effectively in a process, in a workflow. More patients. I can allow more patients to be seen. I can spend time with more patients at the same time. So it really provides that better management of time. And then it really expands. And I'd like to really think of telemedicine as right now in the current state, you can really see patients out of state, or providers out of state can see patients in New Jersey. It expands the reach, which is always amazing. It really shows that we're growing as a health system. We're really growing as access. We're growing our reach. And then I also talked about that provider-to-provider concept. There is also the benefit that a patient can actually loop in another provider. So if I'm seeing a provider and I want another provider to be part of it, I can loop that provider in if that provider is available. So it really provides that perspective. And then overall, it becomes as part of a simple office visit. Instead of in person, I'm going to see you via telemedicine. It's really just replacing the modality. All the care that we're going to provide is the same thing. Standards of care are not going to change at all. It's just going to be the same thing, but the modality is just going to be different.
I think that's a key part, Harshal said. So we are not here to compromise the care we provide by doing a telemedicine. That is probably the most key about all the exciting innovations. There's no compromise in the care. Now, there are times we're going to tell you have to come to our office so that we have to physically examine you to decide a surgery. That's different. So telemedicine doesn't stop us giving the full care you need, and this certainly restricts your exposure to COVID, saves you time, like Harshal explained, and get many people involved in the short time. And this is a futuristic medicine, but I think key point everybody want to make, there is no compromise in your health care. just because you're on the television or a video or digital platform.
Well, and thank you, Dr. Sinavasan. It's always good to hear, from the provider's perspective. And again, all these are certainly precautions. Now, again, there might be some people that may prefer the in-person visit, but from your experience and from your feedback, can you maybe share with the audience, like, what, if any, are there barriers or challenges in using telemedicine?
See, the barriers are getting minimal now. So there may be an adult male not comfortable with the digital platform, the computer and the video and the voice. So fortunately, we have seen all our, like, anytime we have a telemedicine encounter, there's a grandchild, there's a daughter, everybody's involved. Actually, it's very interesting to know that that handicap is being restricted now. More and more family members set it up, and most of them carry smartphones. And there are times you need to physically meet, you don't get the satisfaction, then you have to, yes, we have to do what we have to do. And also physically, sometimes you have to examine somebody to schedule for a particular surgery. And yes, we have to do. So I have to say the obstruction is getting less and less for the digital platform, because there's multiple family members, and even in our office there are staff who primes them, like who can call the family, hey, you know what, we're going to call you, you want to do this and do this, you want to practice with me. And it's interesting, more I see this, by the time second time patients are loving it. So there are many benefits to it. There is going to be always an hindrance, and it's never going to be 100%, but that's okay. That's okay. We have come this far. Very good. I'm very happy that this worked out very well.
Yeah, and I think, to his point, I think it's going to be important for us to manage as best we can. I think through these changing times, one of the key things that I always want to make sure we provide across the board, whether it's a telehealth visit, whether it's an in-person visit, is education. I think bottom line is education, and that's how a patient is more informed. If they're not comfortable using this, if they need to be prepped before, if they need some assistance, we want to provide that information to them ahead of time, so to accommodate them. They may not be in an area where they have a strong Wi-Fi signal. They may not be in an area where they have wireless service. It's really dependent on those kinds of circumstances. And again, going to patient-centric, it's comfortness. It's really about the patient. Does the patient want to do it? The patient doesn't want to do it. It's really about that.
Okay, great. Well, thank you both so very much. I want to give our audience an opportunity to ask some questions of you both. So once again, for anybody who is on our webinar and would like to post a question, please post it in the chat feature. So I'm going to start with our very first question. And I guess, Dr. Seenivasan, this one's going to be geared towards you. How are effective at masks, different types, cloth and I guess medical type or the surgical type, for COVID-19 as people feel as they're trying to protect themselves? And I should say, just a disclaimer, all of us who are unmasked are in our offices by ourselves. So, and as you saw when Shisha jumped into the shot, she had her masks on. So this would be the only time in which we are not masked, is when we are by ourselves. Having said that, Dr. Seenivasan, if you could maybe explain how effective masks are.
You hear a lot in the news media about it. You will be hearing from March. So nothing is 100%. Having said that, we are increasingly finding it, use of mask. And then I don't want to go to the subtypes of mask, N95, the one we use in the operating room. Mask. It helps in majority of the cases. Do you want me to give a one particular number? We haven't taken thousands of masks and did a study on it. But having said that, you have to use the mask properly. It cannot be hanging out of the nose. It can't be hanging out of the chin. So, and then second, if you have, like you think contaminated the mask, you needs to change. So there are several factors to use a mask. And hospital provides a mask when you walk in. You're not happy with the mask, you're having it's dirty, they give a new mask. You go to a store, you forgot your mask, they give you a mask. So the point is, we increasingly find that it prevents the spread as well, it prevents you catching it. So it certainly has a major role, and I cannot tell you, is it 100%? No, but it certainly has a major role in preventing COVID transmission.
So Dr. Sinavasan, I just want to pick up on 2 points that you made. So yes, you are absolutely right. The masks should fit securely around you. That's extremely important, right? Studies show that when you're using gaiters are not effective in preventing COVID because they just hang. So is correct, Dr. Sinavasan? You had mentioned can't wear anything that just hangs. If you do wear something like this is a surgical mask, and if you wear it often, it needs to be discarded pretty much daily if you're wearing it the whole entire day. If you have a cloth mask, then you should wash it regularly. If you're wearing it all day, then you wear it once, you wash it once a day. But as you did mention, it does, by wearing it, right, I protect you from me and you protect me from you.
You said it right.
Right, because it's the COVID-19 is an airborne virus. So, the particles when you talk that travel, right, we get contaminated through our mouth, nose, or eyes, right? So this is a way to protect one another.
You got it. You said it all right.
Oh, good. Great. I just wanted, because you were saying it and there were pieces of it, and I was like, let me just clarify that I'm on point, and that's what you meant. So thank you so much.
Perfect.
So moving on, I wanted to kind of hit on a comment that one of our audience members had mentioned, like, what do you do if you go to a facility and, unfortunately people aren't social distancing? And, I guess, Dr. Sinavasan, I don't know if you would like to address that, but this individual recently went to a hospital and did not feel comfortable because they were there for a test and they weren't social distancing. Which is surprising given all the precautions hospitals are taking.
Right. I mean, you got to be careful. When a nurse comes next to you, she has to come and examine you. She can't be 6 feet away. And she's going to wash her hands. That's when the step 2 comes. So she's going to wash her hands before comes and touches you, examines you, and then she's going to wash after. So there are desks. Everybody's working, wearing masks. And there are, in the operating room, we stand next to each other. We have protective clothes, protective masks, protective hats. So the 6 feet is where you see how you interpret is very difficult for me to explain. I mean, if this person explains which area, what happened, I may get more information, answer specifically. But once you go to the floors, people are standing next to each other, nurses are standing next to each other, using IVs, fluids, touching instruments, and they are touching patients. That it can't be 6 feet. I'm not sure what exactly what was witnessed by this person.
Okay. All right, and you can always use hand sanitizer, right?
Correct.
To wash the hands. So thank you. So Harshal, this one's a question for you. Do doctors have to be licensed in all states for telemeridian consultants or as telemeridian consultants?
Elements.
So the licensure really, it's a statewide thing. If you're licensed in the state of New Jersey, you're able to provide telehealth services in the state of New Jersey. There is no specific, I want to say licensures, but there may be at a hospital level. It really depends on the current situation at the policies that they have at the hospital. But right now, if I'm a provider in New Jersey, I can't see a patient. This is pre-pandemic. I can't see a patient in Pennsylvania because the patient needs to be in the same state I am.
Okay. So then how would a patient prepare for a telemedicine appointment? Is there anything that they should currently do?
So it depends on what kind of telemedicine appointment, right? So if it's a urgent care appointment, that if you go to our app, RWJBarnabas Health Telemed app, and you download it, there's some questions they ask you, what you're going to be seen for, and then you can see a provider. And then if you're going to see a PCP at our medical group, I'm sure they're also going to do the same thing as intake questions, very similarly to if it's an office visit. Like I said, I really want to emphasize the workflow, operations, nothing changes, whether it's a telemedicine visit or an office visit. The intake process happens. It's dedicated. The questions get asked the same way. It's really just a modality switch.
Okay. So then are reimbursements being accepted by insurance companies for all modalities using the telemedicine?
So I don't want to talk about all of them, but yes, a bunch of them are accepting telemedicine visits similar to in-person visits right now for the pandemic. I can't speak to some of the changes that may happen or may not happen.
Okay. So, as a hospital and a healthcare provider, we serve all different sectors of our community, and many times, language barriers, prevent access to care. And when individuals come in, we always use a language line. So can you maybe talk about the language barrier as it pertains to telemedicine, and its role as a cost-effective use?
Yeah, so I can talk to some of the functionality today. As I mentioned, it's that third-party video. You have the interaction from one to one point, but you can engage someone for a translation services, right? So right now it is somewhat of a barrier for telemedicine. It's really across the board, across whoever's using telemedicine. They have to figure out that functionality. I think what the best approach has been, and I've seen that if you're not, if you're comfortable, if you need some translation services, just give the provider a call, and we're happy to speak to you about some of the accommodations.
Okay.
I think right now, that's what we're moving towards, but not to say that we're also exploring other opportunities that we're going to work towards.
Okay, great, thank you. So I guess either one of you could probably field this next question is, do they have telehealth for ICU, the ICU departments or units, the intensive care units?
Yeah, so I'll take it, and then if you want to add something to it. But right now, it's really, and I'm sure you guys mentioned in my introduction, where the system is going through an Epic implementation. So it's one of the goals, really trying to make that front door perspective, and we have some areas of the hospital that do provide that kind of care, and it's simply a provider communicating with a patient in the ICU room. We're always expanding on that thought, and we're going to be exploring what that looks like, what that tele-ICU perspective looks like, and it's going to be very important as we develop our growth and our Epic implementation to really focus on that. So it's, when I mentioned it before, it's really one of those telehealth under things that, it's something that is a telehealth modality that is available to patients. And it's really to accommodate patient care as well as provider care, so we can reach as many patients as possible.
Great. Dr. Sinavasan, did you want to add anything to that?
I would concur. I would say still it's early, and yes, I concur with that. It's a lot developing. A lot of things are rapidly changing. Yes.
Yeah. Well, and it's interesting though that you use telemedicine for, like, if they come in through the ED with maybe some of the stroke patients, correct?
That's correct. We use Telestroke today. So we see a patient right away, didn't want to limit the care, so we're going to provide a telehealth perspective. We use it for behavioral health at many areas. We use it for, it's teleneurology. It's really kind of expansive, and I'm going to really say it's something that is going to continue to grow, and our reach is continuing to grow. But no, it's never, and I want to make this point, it's never replacing in-person care. It's something to accommodate and to serve. It's not going to compromise the standards of care. Our standards are going to be across the board the same thing.
Okay, and it's interesting to note, while if you do have a loved one, right, in the ICU, while you aren't going to use it for appointments, they do use some FaceTime, correct, to let loved ones converse with their with their
Yes.
families. So
Yeah, our patient
all this
experience team has
technology.
yeah, our patient experience team has done a great job. I mean, they've spoken to patients, they've used means necessary to communicate the patient's family with the patient's family members, and I think it really provides and it really shows that patient-centric approach to telemedicine. And it's really, if you think about it, telemedicine, it's not just a clinical visit. It could be anything.
Mm-hmm. So this, thank you, Harshal. This is an excellent question, and I'm going to pose it to Dr. Sinavasan. So when this person went for a blood test, they wore a mask and gloves. They were asked to discard their gloves before proceeding to their appointment. And so why was it wrong to wear gloves?
So it comes to the same point. Just because you have a glove doesn't stop you carrying from one place to another place. The point is, can you wash a glove every touch? It's better to have, I mean, if you ask me, the glove is protection. You're thinking that you're protected your hands and fingers, but you're carrying stuff by touching things to different places. So basically, the whole point is do not touch anything that you don't need to touch. And if you touch anything, wash your hands. That is still superior than wearing a glove. The glove gives this false sense, okay, I am done. But you're touching because you have a glove, and then you're carrying it. Whereas the real point is, do not touch unless you have to. If you touch it, wash it. So then there's no role for glove at all. I hope this explains it. So.
Thank you, Dr. Sinavasan. So I think this is one of our last questions, and I'm going to direct it to Harshal. Are there any state and federal funding being offered to hospitals to promote telemedicine, and how is it being used to address in our vulnerable communities?
So state and federal funding, there's many programs that are out there. There have been out there, and I know a lot of health systems have, kind of applied for the grant, and it's really, right now they came out because of the pandemic, and it's around the use of telemedicine to exactly what you said, to impact COVID patients or high-risk patients. So, what I can tell you is that there are fundings that are out there today.
Great. All right, well, thank you so much. So if there are no other questions, this is going to conclude today's webinar. Thank you all for joining us. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset, visit www.rwjbh.org/Somerset. On behalf of Robert Wood Johnson University Hospital Somerset and AARP, we thank you again for joining our webinar. Have a great afternoon, ladies and gentlemen.